Yo, 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 it's your president, Anna. What is up, respiratory gang? Oh my god. That's like my third take. I'm not editing this either. Okay, so we're starting with question 1 out of the 5 questions I'm choosing. So, what is a passing mirror valve? Who could use this, and how does it work? What must the RT be sure of before placing the valve on the trach tube? So, a passing mirror valve is a one-way speaking valve placed on the outer diameter of a trach. It allows inhalation through the trachea or through the trach, but forces exhalation up through the vocal cords, restoring voice and normal airflow. The valve is used for speech secretion management and restoration of the physiological airflow. Patients can use it with cuffed or cuffless trachs, although if a patient does have a cuff, it must be fully deflated. Patent upper airway and ability to tolerate exhalation through their glottis is necessary as well. Moving forward, the next one we are going to do is what is a laryngectomy, which is question 4. What is a laryngectomy? A patient, and then it gives us a little situation. A patient has a laryngectomy procedure 4 weeks ago. There is an order to cap the tube in preparation for closure of the stoma. When, in parentheses, how long after the procedure can a laryngectomy tube be capped? So, a laryngectomy is a complete removal of the larynx. The trachea is surgically attached to the neck, and the patient breathes solely through their stoma. After a total laryngectomy, the airway is permanently separated, so the patient would not be capped if after 4 weeks, because that's the only way they can breathe. That was a trick question. Nice try, Jane. Okay, we're going to continue with question 2. I know I'm going back and forth. What is a tracheostomy? No, what is tracheotomy? Ectomy. Tracheectomy. What are the indications for the procedure? Does a tracheostomy tube go through the glottis? A tracheotomy is a procedure in which surgical incision or opening is made into the trachea. A tracheostomy is a permanent stoma created by the incision, as well as the tube that resides within. Indications for a tracheostomy are prolonged ventilation, upper airway obstruction, neuromuscular disease, failure to protect the airways, in facilitating secretion removal. A tracheostomy tube does not go through the glottis, but rather enters below the glottis, bypassing the vocal cords entirely. So we're gonna do 3 now. What pressure should the endotracheal cuff be maintained at, and why? The endotracheal cuff pressure should be maintained at 20 to 30 centimeters per of H2O. Reason being, a cuff pressure less than 20 leaves the patient at risk of aspiration, and a cuff pressure greater than 30 leaves the patient at risk for tracheal necrosis. On to our last question. I'm going to go with question number 12, which is what are the 5 valleys? I thought there was only 4, but anyways. So our first one is valve trauma, which is lung injury caused by alveolar distension from excessive tidal volume. Barotrauma, injury caused by excessive airway pressure leading to alveolar rupture. Biotrauma is lung injury caused by inflammatory mediator release due to mechanical stress. And atelectic trauma, which is injury caused by repeated alveolar collapse and reopening. And then I guess oxygen toxicity is the 5th valley. I didn't know that until I did this assignment. Oopsie. Injury caused by prolonged high FiO2 leading to the free radical damage.